Now, a Spanish businessman was paid more than £20 million of British taxpayers' money for his role in securing protective garments for NHS staff during the pandemic. Documents filed in a US court also revealed he was in line for millions more in subsequent payments. A legal dispute being fought in Miami has revealed the sums of money made by some foreign companies which have been supplying the NHS with PPE. And it's led to further questions about the way that the UK government has managed the procurement process. Our special correspondent Lucy Manning has the story.
Designer jewellery from a Miami company is some way from the UK's struggle to get protective equipment. But the owner of Miansai moved from pendants to PPE during the COVID crisis, winning UK contracts worth hundreds of millions of pounds. The owner, Michael Sager, who says he had business connections in China, told a fashion website he was designing his latest jewellery collection while procuring PPE. And court documents from America show just how lucrative his new venture has been, not just for him, but the man he paid to help him, a Spaniard called Gabriel Gonzalez Anderson. The two men fell out, prompting a court case in Miami. The legal documents open the lid on just how British taxpayers' money was being spent. Gabriel Anderson was, the court documents make clear, to help with product sourcing, logistics and quality control. The contract says that when the Department for Health and Social Care got the PPE, Anderson would then be paid what is described as a consulting fee. By June, Sager had successfully delivered 2 PPE shipments to the UK. For helping with that, Gabriel Anderson was paid a consulting fee of $28 million. That's about £21 million. The court documents say Sager's contracts with the government were lucrative, and Mr. Anderson did very well from them. The UK put in more orders. There were 3 more contracts agreed, which would yield yet more money for the subcontractor Gabriel Anderson. A deal for 1 million boxes of gloves. The consulting fee was more than $1.5 million. For another contract for 3 million boxes of gloves, the fee was more than $3.5 million. And a final contract for 10 million gowns for the UK government, and Anderson would get $16 million. But it's claimed Anderson didn't fulfil his role in these contracts, and it led to delays delivering the PPE to NHS staff. The campaign group, the Good Law Project, is planning to challenge the government in court over the deal.
I don't blame Sager for making these vast profits. If government is handing out free money, then by all means stand in line. The real criticism that's to be made here is of the huge profits that government allowed to be generated.
In a statement, Sager said, "At no time have we ever used any middlemen. We have few full-time staff, so for large projects we bring in short-term contractors for additional expertise. We are exceptionally proud to have played our part in providing frontline workers with the millions of pieces of PPE they need." The Department of Health said we have been working tirelessly to deliver PPE, delivering more than 4.9 billion items. Proper due diligence is carried out for all government contracts, and we take these checks extremely seriously. In August, the BBC revealed the government bought 50 million masks that couldn't be used in the NHS, and it's likely to face more criticism tomorrow when the spending watchdog publishes its report into how PPE was purchased. Lucy Manning, BBC News.